Good afternoon, ladies and gentlemen. My name is Claudia Lee. It is my great honor and pleasure to be here as your MC. First of all, we would like to express our sincere gratitude and cordially welcome around 100 fellows from 9 countries, as well as KOFI, the Ministry of Health and Welfare, and host institutions for training. Before we begin, let me briefly introduce the background of the Dr. I종욱펠로우십 program. It is a global training program that aims to strengthen the capacity of healthcare workforce in partner countries, as well as their healthcare system. And our hope is that this program will contribute to building a healthy and sustainable global community by expanding overseas network with partner experts, just like all of you here today. We'll then now officially begin the opening ceremony for the 2021 Dr. I종욱펠로우십 program. And first of all, let's look at a promotional video of KOFI.
Hello, we are KOFI. Spreading healthier life is what we do best. Developing countries, North Korea, overseas Koreans, and migrant workers here in Korea. KOFI dreams of a world where no one is left behind and everyone stays healthy. Now let's find out how we do it. In developing countries, we try to help mothers and babies stay happy. To this end, we check health of pregnant women, help them deliver a baby in a safe medical facility, and vaccinate newborns. For that, we repair hospitals and public health centers in unfavorable conditions and provide necessary medical equipment. We also provide detailed instructions on how to run the hospital efficiently. Do you think something is missing? That's right. To make everything possible, skilled healthcare workers are needed, from doctors, nurses, midwives, biomedical engineers, to health administrators. We invite them to Korea for training. After training, they work together with KOFI and each national health ministry to build a better healthcare system. Now let's find out KOFI's humanitarian healthcare support. KOFI is preparing for the time when the two Koreas will actively interact again by networking the related institutions and hosting the academies. Meanwhile, in Uzbekistan, KOFI operates a nursing home for the Korean diaspora. In Germany, we provide home visit health services for Korean dispatched workers. In Korea, for migrant workers, KOFI provides free medical services including dentistry, OBGYN, ENT, eyes, and X-ray through mobile clinics. How is it? Creating a healthy world together with KOFI, isn't it worth looking forward to? A tripping footsteps for global health promotion. We are KOFI.
And now I would like to take an opportunity to express my deepest gratitude to every single guest for joining us online for this very special occasion during this difficult times of COVID-19 pandemic. So now we're going to introduce our guests in order. And when your country is called out, please show your big waves at the screen. Are you all ready? First and foremost, we have fellows from Cambodia. A very sincere welcome to all the participants from Cambodia. Welcome to the program. And next we have fellows from Ethiopia. Welcome and thank you for your participation. Thank you. And we also have fellows from Ghana joining us. Thank you for your participation. Yes. Fellows from Lao PDR. Welcome to the program. And we also have fellows joining us from Mongolia. Welcome to the program. And we also have fellows from Uzbekistan. Uganda. Yes, welcome everyone from Uganda. We sincerely welcome you to the program. Next we have fellows from Uzbekistan. Welcome to the program. Thank you for your attendance. Next we have fellows from Tanzania. Welcome once again for your participation. And last but not least, we also have fellows joining us all the way from Vietnam. Thank you for your participation and thank you for greeting the participants. Yes, once again, thank you all for joining us today at this event. And I would like to welcome every single one of you to the program. And ladies and gentlemen, without further ado, let's give a big, big round of applause for all the fellows and participants from all over the world. Thank you very much, and all the fellows are going to participate in healthcare training programs in the following 10 hosting institutions, and let me have an honor to name them in the order. First, we have Green Cross Laboratories, and Ulji University R&DB Foundation, Inje University R&DB Foundation, Gangbuk Samsung Hospital, Korea Institute of Radiological and Medical Sciences, Myeongji Hospital, Seoul National University College of Medicine, Seoul National University R&DB Foundation, Yonsei University R&DB Foundation, and last but not least, we also have Yonsei University Wonju R&DB Foundation. Thank you once again for your participation, and we are very much pleased to meet you all, and I hope this program will lay the very groundwork for all our continued friendship and relationship. So now, without further ado, let me invite KOFI's president, Dr. Kim Chang-yeop, for his welcoming speech. Ladies and gentlemen, please welcome him with a big round of applause.
Good afternoon, distinguished guests, ladies and gentlemen. I am Chang-yeop Kim, the president of Korea Foundation for International Healthcare. Maybe you are very familiar with the abbreviation as KOFI. I am very honored and privileged to have you here, even though on the occasion of opening ceremony of the 2021 Dr. Lee Jong-uk Fellowship Programs. I am pleased to express my words of gratitude to the Director General of International Cooperation, Chan-sik Yoon, from the Ministry of Health and Welfare of the Republic of Korea, actually coming all the way from a remote city of Sejong to Seoul to congratulate this occasion. Also, I sincerely express my appreciation to the training institution for putting all their efforts to make this year's training program successful. Already you might know that KOFI has conducted Dr. Lee Jong-uk Fellowship Program since 2007 to honor the legacy of the late Dr. Lee Jong-uk, the sixth Director General of the World Health Organization. This program is designed to build capacity of healthcare workforce in partner countries. Since 2007, 1,007 healthcare workers from over 30 countries have successfully completed the program and playing major roles to strengthen the health system and their respective countries. Especially at this moment and place, I would like to think about the historical context of the global pandemic, COVID-19. Actually, for today's ceremony, due to various policy measures to contain the virus, some participants are under the mandatory quarantine in Korea, and others still have not departed from their own countries, remotely participating through online programs. COVID-19 is changing our daily lives as well as deteriorating global economy. Worst of all, number of deaths is keep increasing globally. Even after 2 years of fighting together to contain the virus, we are still in the midst of the pandemic with an emergence of yet another variant, Omicron. As you all know very well, individual country cannot overcome the global health emergency alone. The world have to put together all the efforts harmoniously. Supplying sufficient vaccine to each country is very important. But above all, improving capacity to each and every step of the health system strengthening, from prevention, surveillance, diagnostics to patient treatment, even the rehabilitation at the community is the most important task. I believe for at least several more years, hospitals, medical institutions, and their workforce of all the countries will have to focus on building the system to respond to the pandemic while sustaining the essential health services. There will be an ever-increasing global demand for the role and knowledge of the healthcare workforce. In other words, all the countries have to be prepared to develop healthcare workforces which could respond to the so-called post-corona era. I have to repeat it again and again. At this place and moment, our courses and our fellowship programs, we have to cope with post-corona, post-COVID challenges. Also, we could call it as post-corona regime. I'm sure that with a strengthened personal capacity through the program, all the fellows will contribute to the improvement of own country's national health system, as well as participating to combat the global health emergencies. Furthermore, to be a part of the combined efforts for harmonized coexistence of humankind. I truly wish all the fellows to be in Korea soon, and once you are here, be healthy and safe while making good memories to take back home. Once again, thank you for participating in this event. Hope you and your family to be healthy and happy. Thank you. 감사합니다.
Thank you, Mr. President, for your warm welcoming remarks. He emphasized how it is important for us to work together in order to overcome the global pandemic, as well as emphasizing the meaning of the Dr. Lee I종욱펠로우십 program. Thank you once again, Mr. President. And now let's meet Director General for International Cooperation, Mr. Yoon Chan-sik of the ROK Ministry of Health and Welfare for his congratulatory remarks. Ladies and gentlemen, let's welcome him with a big hand.
Hello everyone. 안녕하세요. I am deeply honored and impressed by the sleepless screen across the globe. I am Chan-sik Yoon, Director General of International Cooperation at the Ministry of Health and Welfare of Korea. It is a great pleasure to meet all of you. I genuinely welcome you to 2021 Dr. Lee I종욱펠로우십 entrance ceremony and congratulate you on joining the program. Dr. Lee I종욱펠로우십 is Korea's representative training program designed to invite global healthcare workforce from partner countries to build their competence. Until the year 2020, a total of 1,030 trainees from 29 countries have completed the program. I hope you acquire a lot of new knowledge and know-how and continuously contribute to improving public health in your home countries as health experts through this training program. Also, I hope this program serves as a platform for your global networking. Dear friends, ladies and gentlemen, I would like to take this opportunity to talk about three historical doctors that we know very well and be reminded of their legacy together. The first doctor is Hippocrates of ancient Greece, honoring the Hippocratic oath. I want all of us to keep in mind what he said. Wherever the art of medicine is loved, there is also a love of humanity. This is also the spirit of COFI in global cooperation on healthcare. The second doctor is Albert Schweitzer. He said, at times our own light goes out and is rekindled by a spark from another person. Each of us has cause to think with deep gratitude of those who have lighted the flame within us. I think the spirit of solidarity and cooperation in the pandemic situation can exist because of warm people-to-people and nation-to-nation relationships. The third doctor is Dr. Lee Jong-uk. Dr. Lee Jong-uk, a former Director General of World Health Organization. He dedicated his whole life to caring the ill at the humblest places in his fight against diseases. He was Dr. Schweitzer of Asia, king of vaccines, and a man of action. His dream and endeavor changed the paradigm of the global public health care. At this critical point, where we have to overcome the current pandemic and be prepared for potential pandemics in the future, Dr. Lee Jong-uk Fellowship Program will play the central role in global cooperation on healthcare. At this point, you and I, or all of us, have to be Dr. Lee Jong-uk. I hope you grow into your ideals so that life cannot rob you of them through this program. I would like to once again congratulate you on joining the program and show you my support as much as words can express. Thank you. Love you. 감사합니다.
Thank you very much for your wonderful congratulatory speech. I'm sure all the participants are inspired and also encouraged about this program. And you mentioned 3 historically great doctors, including the late Lee Jong-uk. And next we're going to have a photo opportunity. Please allow me to invite President Kim and COFI's Dr. Lee Jong-uk Fellowship team members, invitees, and those from hosting institutions. Please come near to the stage. They're now fighting about the spot. Yes. Thank you very much. Please share your beautiful smiles as well from the screen. Yes. This time with the mask on. Okay. Yes, let's do the mask on photo. Let me count to 3. 1, 2, 3. Thank you very much for your participation. I believe that the photos will bring out our great memories in the future. Thank you very much. And in response to the congratulatory and welcoming speeches by our guests of honor, Dr. Duan Thi-Tu Hua will deliver her speech on behalf of all Asian invitees. She's going to join us online because she's currently going through the 2-week quarantine measures after arriving in Korea. So, ladies and gentlemen, let's invite her with a big round of applause onto the screen.
Thank you. Good afternoon, dear distinguished guests, professors, and colleagues, ladies and gentlemen. My name is Duan Thi-Tu Hua. I'm from Vietnam. Today, I'm very honored and delighted to speak on behalf of Asian Fellows from Vietnam and Laos in this online ceremony. We are very honored and delighted to be fellows of the Dr. Lee Jong-uk Fellowship Program, particularly in health professional education. Although it's currently COVID-19 pandemic, Korea Foundation for International Healthcare, KOFIH, has managed to organize this course for us. It was amazing and wonderful when we received a large box with many gifts inside as arriving on the first day in Seoul. It's so that you care about us. On this occasion, we would like to express our deep gratitude to the Korean government, Korea Foundation for International Healthcare, and hosting institutes, the Seoul National University, for all the thoughtful and dedicated support. And also thanks to staff of the institutes for all the help from beginning until now and later in the course. There may be initial difficulties, such as getting used to the cold weather, the quarantine periods, but we believe that with the support and kindness of KOFIH and staff, we will overcome difficulty easily. Although we are from different professions, nursing, medicine, and public health, we will cooperate as a team, and we will do our best to complete the course successfully. We believe that we are always accompanied by respectful teachers who are with wisdom, enthusiasm, and commitment. Teachers will transfer valuable knowledge, skills, and experience to help us transform medical education. We will study great things in next few months. The program will provide us with the updated knowledge, the higher skill, and help furthering the training of healthcare workforce in our own countries. We hope that besides learning, we will have time to explore beautiful landscapes and country of Korea in Seoul and surrounding areas. Wishing all professors, officials, fellows, and all of you good health and happiness. Wishing my dear fellows full of energy, active learning, and success. Christmas is coming. We wish you a Merry Christmas and a Happy New Year 2022. Thank you. 감사합니다.
Thank you very much, Dr. Hua, for showing your gratitude and also your commitment for the program. And thank you for coming to Korea all the way from Vietnam despite the cold weather. But I'm sure over time, you're gradually going to get used to it and will fall in love with it because of the wonderful programs that they have prepared for you. Thank you once again for your awesome speech. And now let's move on to the next speech, and it will be delivered by Dr. Ivan Kishol as a response speech on behalf of all African invitees this time. And he's also joining us from online because he's also undergoing the 2-week quarantine measure, and he's all the way from the Republic of Uganda. Ladies and gentlemen, let's invite him with a big hand on the screen.
Yes, thank you very much, moderator. The President of the Korea Foundation for International Healthcare, the Director General for International Cooperation, Ministry of Health and Welfare, Republic of Korea, the Secretary General of KOFIH, the Director General of KOFIH, fellow participants and guests, ladies and gentlemen, I'm really honored and humbled to speak to you on this opening ceremony on behalf of the fellows from Africa, supported by KOFIH under the Dr. Lee I종욱펠로우십. As introduced, my name is Dr. Ivan Chisule. I am a physician working at Mulago National Referral Hospital, the biggest hospital in Uganda, and I've also joined the Dr. Lee Fellowship as a clinical expert in emergency medicine. Along with me, I came with other 9 participants from Uganda, and we are a total of 100 fellows from 9 different countries, as was introduced. I'm humbly honored and really very grateful to be here in Seoul. We arrived yesterday and currently undergoing quarantine at Marina Bay. But we are really very grateful for this opportunity that has been given to us to undertake this course. We know the importance of learning and knowledge acquisition because this has helped to improve the situation of mankind and to advance culture. We have seen from the presentation by Professor Yu how education has transformed the Republic of Korea from the post-war era till now, and being one of the largest economies in the world. So we also believe that this opportunity is going to help us to acquire knowledge and skills that will help us to transform healthcare in our countries. The other, we also hope to gain experience on how to improve healthcare so as to make services better in our nations, and also to get the exposure. We have seen the different climate, we have seen the different conditions in Korea, and we hope that this exposure will help us to be better and provide better healthcare to our nations. So we are really grateful that we are here, and we hope that by the end of our stay here, we shall really have acquired that knowledge and skill and the exposure to help us to do better when we go back to our countries. I also wish to emphasize the support that we have received all the way from Africa, the flight tickets, the quarantine facilities, the items which we received this morning. We are really very grateful, and this will help us to ease our stay here and also to enable us to have a better learning environment. Living and studying in Korea would not have been possible without your generous support, especially in these COVID-19 situations. So, and from the orientation that we have had with Kofi and Yonsei, we are going to learn the Korean language, we shall learn the culture, and we shall actually need the knowledge and experience that we shall get to go back and apply in our countries. So we shall always keep in touch with our professors and colleagues here in Korea and continue to learn from them in both profession and life. And we shall dedicate the knowledge and the skills we shall learn in the planning and implementation of the major goals, the development of our countries, and that is the universal health coverage. Finally, I would like to thank the Dr. Lee I종욱펠로우십프로그램 and Kofi again for your investment. It's really a huge investment in us, the fellows, in our training. I'm sure that without your support, perhaps many of us would not have got the opportunity to travel this far to Seoul and stay here for 3 months. By inviting us for this program, you are allowing us to have a once-in-a-lifetime opportunity and also to achieve one of the most important goals of life, that is learning. I hope that one day we'll be able to help others achieve this goal in life, like you have kindly helped us. Thank you for making this possible. We shall always be grateful for this opportunity, and please keep on inviting other colleagues from different countries for the betterment of the healthcare in our countries. May God bless you so much. Thank you all.
Thank you, Dr. Kyusule, for your wonderful speech, and thank you for showing your gratitude by calling this a once-in-a-lifetime opportunity. And I wish your participation in our program will be very, very successful. And once again, I would like to kindly ask all the invitees to stay connected, because next up is very great. Next, there is going to be a very special stage with a Korean traditional music band, and while they get ready for the show, we're going to watch a very short video clip about the life of the late Dr. Lee I종욱.
우리나라의 이종욱 박사가 WHO의 차기 사무총장으로 공식 선출됐습니다. 한국인으로서는 처음으로 유엔 산하 전문기구의
In January 2003, a Korean was appointed as the head of the international agency for the first time in world history. Dr. Lee I종욱, the sixth Director General of WHO, took the position after serving at the organization for 20 years. Working with leprosy was what ultimately led the young Dr. E to WHO. He began to follow the path of finding a cure and treatment for leprosy after meeting a leprosy patient at a community health center in Korea. He first joined WHO in 1983 as a leprosy consultant in the South Pacific. Excessively filled various posts, such as head of the global program on vaccines and immunization, and director of the Stop TB department. After being inaugurated as Director General in 2003, he focused on building a healthcare system to benefit all people around the world. While serving as Executive Secretary of the Children's Vaccine Initiative in 1998, Dr. E achieved the feat of reducing the polio prevalence rate to 1 out of every 10,000 people in the world. For that, he was given the nickname Vaccine Czar. Dr. E spearheaded the agency's efforts to combat and prevent AIDS, one of the most serious life-threatening communicable diseases, through the 3x5 program, which aimed at providing antiviral AIDS drugs to 3 million AIDS patients in less developed countries by 2005. He was also widely recognized for his pre-science in predicting an increase of epidemics in the global era, and for coming up with effective response measures, as evidenced by the establishment of the Framework Convention on Tobacco Control, the first international agreement in the global healthcare sector, suspension of the spread of avian influenza in 2004, and the opening of the Strategic Health Operations Center, SHOC, or the JWE Center at the WHO headquarters in Geneva. Dr. E died unexpectedly on May 22, 2006, in the third year of his 5-year term in office. His many achievements are still highly regarded by healthcare workers across the globe as model cases that highlight their way forward.
I would like the Assembly to observe now 2 minutes of silence.
His focus on the importance of fostering young healthcare workers in less developed countries, and his drive for practicing his belief of doing the right thing in the right place in the right manner, have become the philosophy of KOFIH, which was established in memory of Dr. E.
My father loved to experience more, do more, see more. I believe that this adventurousness made him great at work and at life. If ever he seemed stern or impatient, I believe it was because he had so much to accomplish in the time that he had.
KOFIH has carried on Dr. E's lifetime dedication to health through operating various memorial programs. We have invited and trained next-generation healthcare workers of partnership countries every year since 2007 through the Dr. I종욱펠로우십. We have recognized groups and individuals that have contributed to public healthcare by awarding the WHO I종욱 Memorial Prize for Public Health. We have also operated the I종욱 Memorial Project and the I종욱 Global Young Frontier Program to foster future healthcare leaders.
Very much concerned about the health condition of the people, and this is our response. I'm glad that we are building this.
Don't stay in Zambia, but for the world, there's a second chance.
That they know that the world cares for them, and otherwise, why would we be here?
What a wonderful video, and I hope you enjoyed it a lot. It was a great opportunity indeed for us to learn about the life and the dedication of the late Dr. Lee Jung-wook. Next, we're going to have a performance delivered by a Korean traditional music group, Hana연. And Hana연 means a relationship that is united through music. And they are a Korean traditional ensemble that promotes Korean music all the way out to the world by reinterpreting various genres of Korean folk songs, modern songs, by featuring various traditional instruments of Korea, such as 가야금, 하금, or 대금. They are going to play a total of 4 songs for us today, and the first song is going to be 오나라, a song featured in 대장금, a very famous K-drama, Over the Rainbow, Another Day of Sun, which is featured in a Hollywood movie called La La Land, and last but not least, a Korean traditional song, 경기 아리랑. Ladies and gentlemen, you have waited for long, and let's enjoy Hanayeon's performance on the stage.
나나니 나려도 못 노나니 Ladies and gentlemen, we are Korean traditional music group Hana연. Thank you for inviting us today and very glad to see you. Hi. Okay. The last song is Korean traditional folk song 아리랑. Please enjoy. Thank you.
Wow, what a wonderful performance. I indeed loved it, and especially the last song was a home run, I think. And maybe during your stay, you can have an opportunity to learn this very traditional Korean song. And ladies and gentlemen, this brings us to the very conclusion of today's opening ceremony. Once again, thank you very much for joining us today, and I hope you have a wonderful stay here in Korea. This has been Claudia Lee, and have a wonderful evening.